Barbra Streisand, the award-winning actress, has been vocal about her shock that men and women are not treated equally for coronary heart disease, a condition which has impacted her family in the past. Barbra Streisand is well known for her achievements in film and television, which have led to her winning an Emmy and an Oscar. But not everyone knows that the 79-year-old has been working to improve the treatment for women with heart disease years after her mother was diagnosed. In 2014, she started the Women's Heart Alliance. Ms. Streisand told People magazine in a recent interview, "15 years ago I read a story in the New York Times about gender differences in heart health. I was shocked to learn that more women are dying from cardiovascular disease than from all cancers combined and aren't receiving the same attention in diagnosis and treatment as men. It just never made sense to me that women and men weren't treated equally." In the United States, where Ms. Streisand is from, 1 in 6 women has coronary heart disease. According to the Heart Research Institute in the UK, more than 3.5 million women live with the condition. Around 77 of those with the disease die every day. Heart disease describes the process of the heart having its blood supply blocked or interrupted by a buildup of fatty substances such as cholesterol in the coronary arteries. Ms. Streisand added, "For so many years, heart disease was thought of as a man's disease. Women with similar or more unique symptoms were often misdiagnosed as having digestive problems or being emotionally stressed." A large study from 2019, funded by the British Heart Foundation, found that despite advances in diagnosis tools, using sex-specific blood tests, women were half as likely to receive the treatment they were recommended. Coronary revascularization, for example, was given to 15% of women in the study compared to 34% of men. This surgery uses a stent to clear up the coronary arteries. Preventative treatments, such as the use of statins, were only given to 16% of women compared to 26% of men. It's essential that healthcare professionals are aware of the inequalities in heart care for women, and that everyone can spot the symptoms of a heart attack, said Drive Sonia Babu Narayan, the Associate Medical Director of the British Heart Foundation and cardiologist. Ms. Streisand's organization recently launched a campaign to sound the alarm and bring attention to the health crisis. It is very important that young women are aware that they are experiencing heart disease at increasing rates, she said. There are many coronary heart disease symptoms that men and women should look out for. These include extreme tiredness, shortness of breath, heart palpitations, joint pain, depression and anxiety, and rashes. Other symptoms, according to the NHS, include feeling sick and a loss of appetite. One of the best ways to prevent heart disease is by lifestyle changes, such as doing more exercise and having a diet low in fat. Stressed out diva Barbra Streisand was spotted looking worse for wear at an LA hospital, sparking heart attack fears among friends. The 77-year-old superstar appeared ashen and frightened as doctors examined her leg in the lobby at Cedars-Sinai Medical Center in early June. Noted New York internist Dr. Stuart Fisher, who has not treated Streisand, said physicians might have found a deep vein thrombosis in her leg and the large clot could enter her bloodstream and cause a fatal heart attack. Barbra has looked and acted like she has the weight of the world on her shoulders, a source said. It's no wonder she's on the verge of collapse. The incident comes on the heels of reports of stress in the singer's 21-year marriage to James Brolin, and concerns about her upcoming tour dates. She has also struggled with a previous eating disorder that puts her at risk of several potentially deadly medical conditions, including heart failure. She has reportedly had a host of health and psychological issues through the years, said Dr. Fisher, author of the Little Book of Big Medical Emergencies. Streisand also has revealed a history of heart disease within her own family. She said, I have had both close friends and family members impacted by heart disease. Sadly, I think most people have had someone in their lives who has suffered a heart attack and or has all the risk factors for cardiovascular disease.